our booster campaign was that the 60% of the people in severe and critical conditions were immunized, doubly immunized, fully vaccinated. And as I said, 45% of the people who died in this fourth wave were doubly vaccinated.
In terms of the number of people in hospital who've been double vaccinated, we know it's around 60% of the people being admitted to hospital with COVID have been double vaccinated.
What about all the fully vaccinated people who get the breakthrough infection? Can they pass it on? Could they pass it on to their children? Could they pass the virus on to older people, especially more vulnerable people with underlying health conditions?
And that's exactly the point that we made in our guidance. So yes, they can with the Delta variant. And that was the reason that we changed our guidance last Tuesday. But what they can't do anymore is prevent transmission.
That's the primary endpoint of most of the virus, is to prevent clinical disease, to prevent symptomatic disease, not necessarily to prevent infection.
At the moment, I don't believe we have the evidence on any of the vaccines to be confident that it's going to prevent people from actually getting the infection and therefore being able to pass it on. So I think till we know more, we need to assume that people who have been vaccinated also need to take the same precautions.
I think we need to be careful as we get vaccinated not to overinterpret the results. Our results show that this vaccine can prevent you from being sick, it can prevent you from being severely sick. They do not show that they prevent you from potentially carrying this virus transiently and infecting others.
I hear a lot of times people feel it's a rare event that fully vaccinated people may die. I happen to be the senior advisor to Governor Hogan in the state of Maryland. In the last 6 to 8 weeks, more than 40% of the people that died in Maryland were fully vaccinated.